Infertility impacts 1 in 6 people, according to the World Health Organization. For infertility awareness, we're talking about what causes infertility and when a person should talk to their doctor about issues conceiving. Dr. Rebecca Lobell, OBGYN at St. Luke's Women's Health East, joins us now. Doctor, thank you for your time today. We're going to jump right in and start with, what is the simplest definition of infertility?
The easiest thing to remember is the inability to achieve a pregnancy after 12 months of unprotected intercourse.
And when do you start talking to patients about their plans to conceive?
I really like to use their annual exam as an opportunity to find out their reproductive goals. I just ask a simple question of, do you plan to have any kids in the next year? And that really opens us up for them to give me an idea of what their goals are and give some idea of when they should come back and see me if they aren't able to achieve a pregnancy.
Sure.
I also really would encourage preconception visits as well as another opportunity to dive into a little more detail about your own goals for pregnancy.
And what would you say are some things that can cause a woman to go through infertility?
Sort of the easiest things to break it down into would be male and female factor causes. So for males, it's going to be anything that causes an abnormal semen analysis, which could be a whole list of different conditions, but that's going to be the main workup for a man is going to be a semen analysis. For women, it's a little more detailed. And so you can break it up and think about things that cause hormonal issues, things that cause ovarian issues, such as ovulatory dysfunction, decreased ovarian reserve. Break it down into tubal factor, anything that's going to block the egg and the sperm from getting together, and then uterine pathology, so an endometrial polyp, a fibroid, a genetic condition that cause an abnormality of the uterus.
When would you say is a good time for a woman to have a conversation about infertility with their OBGYN?
That's really age dependent. So for women under 35, without any, and this is kind of an important caveat, without any conditions that put them at high risk for infertility. But for women under 35, it's going to be that 12-month mark. For women over 35, we recommend coming back at 6 months. And for women over 40, because their ability to conceive has decreased significantly by that age, we would recommend at least offering them immediate evaluation and treatment if, again, that aligns with their reproductive goals.
So a patient does come back having difficulties conceiving. What are some of the next steps or tests that you might offer them?
Absolutely. So I would encourage you to make a infertility evaluation appointment, and you can do this with most general OBGYNs. You don't necessarily have to talk to a reproductive specialist right away. You can come into your OBGYN. We're going to do a detailed history, again, including both that female and male piece. And then we're going to walk through that workup where we are going to order that semen analysis for the men. For women, it's going to be kind of a variety of hormone testing as well as imaging. So we can look to see if those tubes are open and that egg and the sperm are able to get together. And then we're going to do a pelvic ultrasound most commonly to evaluate ovaries and uterus in more detail as well.
Well, lots of information. Thank you for all that you do, and thank you for spending some time with us today, Dr. Lobell.
Absolutely, my pleasure.
To learn more about St. Luke's Maternity and Obstetrics or make an appointment to talk with an OBGYN about infertility concerns, visit stlukeskc.org/maternity.